Welcome back to the Postpartum Plan podcast. This podcast is designed to support and empower you through postpartum. Whether you're expecting, in the early postpartum days, or beyond, this space is for you. I'm your host, Madison Fugere, a dedicated postpartum doula and pediatric sleep consultant, striving to help parents feel confident and supported in their parenting journey. Each week, I'm sharing practical tips and expert advice to help you navigate all the postpartum things with confidence. Well, as much confidence as you can. Let's embark on this journey together, making your parenthood as serene and supportive as possible. Living in a log cabin on 5 acres in Athol, Massachusetts, along with her husband Max, 2 children, 1 dog, and 2 cats, Lo has a heart for pregnant and nursing parents. It was her own intense struggle to breastfeed her children that led to a passion in birth and lactation work in the first place. However, listening to the struggle of so many others in the same situation is what motivated her to continue as a lactation supporter, educator, and podcaster. As an international board-certified lactation consultant, Lo focuses on helping each client feel proud of every ounce that they make and to recognize each hurdle they unfairly faced. She launched the Milk Making Minutes podcast to empower and explore baby feeding struggles and triumphs. Through the lens of systemic and cultural failures, every listener will find a space to better understand their bodies did not fail them and their successes really were the miracles that they felt them to be. Before the episode starts here today, I just wanted to give you a disclaimer that for some reason my microphone was sounding really muffled and obnoxious, so I apologize for that. And also, about halfway through our episode, Lo had her little one needing to come in and need some help with a situation. So you'll hear us leave and come back, but enjoy the episode.
Thank you so much for joining me today. I'm excited to navigate the world of breastfeeding with you and the topic of everything difficult that comes along with it, which is a big topic, but I think there's going to be so many things to talk about, and hopefully we're able to kind of reassure parents here that, it isn't always the easiest walk in the park. And so if they're not having it so easy, they're not alone, right?
Mm-hmm. Yeah, absolutely. Yeah, thanks for having me. This is going to be fun.
I'm excited. Yeah. So do you want to tell everybody a little bit before we kind of dive into it? Your intro will have some information, but tell everybody a little bit about you, what you do, and, how you got into the field that you're in now.
Yeah, sure. So my name is Lo Nigrosh. I am an international board certified lactation consultant. That's usually referred to as an IBCLC. I am a certified childbirth educator. I'm also a doula, although I have not attended births I think my last birth was about more than 6 years ago. So I haven't been doing a lot of on-call birth work. And I'm a mom of 2. My son, Charlie, will be 10 this month. And my daughter, Jolie, is 6. And it was my own intense experience trying to feed my oldest that really brought me into the world of lactation. I worked as a certified lactation counselor for many years and was a peer counselor with Breastfeeding USA before I qualified to sit for the board exam to be an IBCLC. And I also host a podcast all about human milk making called the Milk Making Minutes. And there are 2 episodes a week that get released. One is just people's personal stories. So the good, the bad, the difficult, the change of plans that happen. And then a second episode is either just me. It's usually a shorter format discussing, how to handle mastitis or, are weighted feeds important, or dealing with gestational diabetes and then diabetes afterwards, all sorts of topics. And then sometimes I also have other professionals on sharing their expertise.
That's awesome. I love that. And I'm excited to record in a couple weeks with you. So everybody should definitely head over and listen. I'm super excited to tag along and join yours as well. But I think it's so amazing that you have that kind of bank of information for people too. And being able to share all those different stories is got to be so rewarding in the fact that people are experiencing things so differently. So to be able to hear different stories, it's got to be reassuring for listeners.
Yeah, yeah, that was the goal. I don't know if you ever have listened to the Birth Hour podcast, but
Mm-hmm.
I listened to it for years in between my first and second daughter. And then as a doula, I often would listen just to get the perspective of how people were feeling during their varied birth experiences. And as I got more and more into the world of lactation, I thought something needs to exist like this for people
Right.
in regards to feeding their babies, because it is so challenging. And often people get there and they don't understand why it's so challenging. If it's a natural process, quote unquote,
Right.
natural process, why is feeding our babies from our bodies so challenging, which is sort of the focus of my practice as an IBCLC and of the podcast.
Yeah, I love that. I mean, that kind of brings us right into what we're talking about here. And when you brought up this topic of, what makes it so difficult, I really was like, there's so many things. This could go on forever. But I was like, the main focus of what I thought of when you said that was, oh my gosh, people will finally feel reassured that like it's okay. Because I've
Mm.
had so many clients be like, I didn't realize it was going to be this hard. No one told me it was going to be this hard. It's supposed to be instinctual. Like, why? Is there something wrong with me? Is there something wrong with my baby? And like, sometimes there's things, but I find that most times it's just that it's a learning curve, right?
Yeah, there's a learning curve, and there are a lot of cultural and medical systemic factors that have made feeding our babies from our own bodies way more challenging than it was historically.
That's so interesting. Yeah, can you
Yeah.
dive into that? I'd love to hear about that.
Yeah. So I first want to just acknowledge that whatever your baby feeding experience was, you get to own how you felt about it. You get to decide whether or not it was difficult or easy, like only you can say. And I know often people get faced with changing the plan or not. And there's no right answer to this.
Yeah.
Every individual has to look internally and say, what is it that I most need given my unique set of circumstances, both your temperament, your mental health status, the amount of support you have, the people you have in your corner, your capacity to pay for support, whether or not there are peer support groups around you. So there is a lot that goes into baby feeding. And, I talk to some people and we get to this question, if they're my clients, we get to this question of, would you like to consider changing the plan? And for some people, it makes them feel better to just say, you know what, I don't want to struggle through this anymore. And a lot of people are surprised to hear that many lactation consultants like myself, we do work with formula feeding parents. We do
Yeah.
help them find bottles that promote oral motor development. We do help them feed their babies in a way that still promotes bonding and is most closely aligned to feeding a baby from the body for their long-term development. And so you do not have to stop working with an IBCLC just because you are changing the plan. So I just want to point that out.
I love
And
that.
then, yeah. And then secondly, some people get to this point where they are struggling so hard. And the best thing for them to do is to keep trying. And that is what is going to promote their own health, their own mental health, the health of their baby. It will help them bond with their baby more. And so, if you have a friend who is really struggling, the best thing to do is just be a great listener and to be a space for them to place their feelings and not tell them what they should do based on what your experience was, because every person is going to answer this question differently.
Absolutely.
Yeah. So
Absolutely.
I just want to start by saying that. And then, when we look at what makes feeding our babies from our bodies so challenging, it starts way back in our earliest memories. And I say this because I've been doing a little unofficial study, and I asked all of my clients and all of my podcast guests what their exposure to seeing baby feeding was as young children. And 9 times out of 10, that person says, oh, I never saw somebody feed a baby from their body. And when I played with baby dolls, I had bottles that I fed
Right.
them. I never did imaginative play with baby dolls feeding from my body. And the first time I ever saw a baby feeding up close and personal was either on a video in preparation, maybe during a childbirth education course, or when I was holding my own baby. And this is the first big barrier. And I I often use an analogy of learning to cook. If somebody has grown up with their parent or their grandparent cooking in the kitchen, you pick up on small little things as you go. So
Right.
you notice when your grandma puts in the onions, you notice when she adds the tomatoes, you notice when she turns the heat up, you notice when she turns the heat down. She's making all these little micro adjustments, and you cannot just take one course on one day and know how to do all that stuff.
Right.
And then, so those of us, I did not grow up cooking with anybody in the kitchen. So when I became an adult and it was my turn, I made lots of mistakes. I burned lots of eggs. I still to this day burn the garlic. And I'm in my 40s. I've been cooking for over 20 years now. And, it just, you pick up on things as you go. And I used to wonder when I first started cooking, how do all the people who I have seen cook without recipes in hand do that for
Right.
so many years? And now 20 years into it, I have some things that I can just throw together, but
Yep.
I definitely could not do that in the beginning. And it is the same with feeding babies from our bodies. If we have not been exposed from our earliest days and often to baby feeding from the body, it is not going to feel natural.
Right.
And so we just have to acknowledge that culturally, we do not live in an environment where it is common to see people feeding babies from their bodies. We might see them at a distance, but that's not the same as watching
Right.
how someone positions the nipple to put it into a baby's mouth, or the micro adjustments they're making to make themselves more comfortable and their babies more comfortable. So, it makes sense that it's difficult once it's our turn.
And I mean, that's something that I've heard a couple people say. And to be honest with you, I've heard that, right? Like society, just this generation as a whole, and just as time's gone on, people haven't seen that, right? It's now been something that people hide and they cover up, or they go in another room, or especially around children, right? Because children don't have filters, so they're going to ask all these questions, but to them it's just innocent questions, but to us it feels like a question you shouldn't be answering, right? But I would have never even thought, I mean, I guess I could have, but if I thought deeply about it being a barrier though to parents feeding themselves, like their own babies in the future, right? You think about how frustrating it is, just that's how the world sees things, but you don't think about how, oh my gosh, I haven't seen that, which means that I don't really know how to handle it myself.
Yeah. And in cultures, there are anthropological studies that show that in cultures where breasts are not as sexualized, like there are many places in both East and West Africa where, people do not expose their legs, for instance. They would always wear long skirts because that is a more sexualized part of the body, but will walk around topless. And so the children of those communities grow up seeing every community member feeding babies way into toddlerhood from their earliest moments. And they are present at births. They are present for those earliest moments of baby feeding. The families tend to sleep together in larger groups, and so sleep is less of an issue. And there are anthropological studies that show that humans evolved in groups which provided 5 to 12 primary caregivers for every baby.
Wow.
So that means that some of those primary caregivers were also feeding your baby, and you had a lot more support to care for the infant, and it was not just dependent on one or two adults to care for babies. And now we live in these very isolated family groups. Many of us live far away from our extended family and have different parenting practices than our extended family. And so even if we live close, we might not get as much support. And so this is not to shame anybody whose situation is such that they don't have support. It's to name, of course, it feels difficult, because this is not how humans survive for the vast majority of human history.
Right. I think that's, yeah, such a great point to make. I mean, there's got to be, beyond like this, pre-baby even kind of being exposed to these things, right? They're not adapting, they're impacting is the word I was looking for. They're impacting your experience once you have a baby. Now, once people are reaching out to you once they have babies, typically, is that correct?
Yes, I do love to do prenatal consultations too, and I can usually bill insurance for that. So even virtually, I can meet with people and help them create an ideal early postpartum plan based on what their unique situation is, because that's going to be different for everybody. Somebody who has 6 weeks off before they are returning to work, they are going to have a very different postpartum plan than somebody who has a year off or 12 weeks off. And so understanding that we are all in very different situations, and that means there is no one size fits all to creating a baby feeding plan, and then knowing it will be adapted once the baby's there, but having the right tools under your belt for those adaptations is really important.
Absolutely. Yeah. So, do you find that the people that come in to you prenatally end up having a better feeding experience postpartum, and then than those who just kind of show up postpartum and are having some sort of a struggle?
Well, so by having a better experience, I think they feel better regardless of how the baby feeding goes for them. So it doesn't mean that everybody who does prenatal consults within IBCLC will then go on to have the picture perfect baby feeding story, but they feel less grief. They feel less blame. The mom guilt doesn't pick in as strongly in the beginning, because they recognize that whatever situation is happening, it's not their fault. And they can roll with the punches a little bit better, I find.
I think that's awesome. That makes total sense. Now, when people come to you postpartum and they're experiencing some struggles of whatever it may be, baby's not latching or they're in pain or whatever it may be, do you find that there are some commonalities in like the struggles that they're having, or commonalities in, barriers that they're experiencing that's not giving them the success that they're looking for?
Oh, yeah, absolutely. So, first of all, birth setting and what happens directly after the birth, and the types of supports or the language used with people wherever they have given birth has a huge impact. And this is one of the big barriers I find. So the other thing, I'm just going to back up and say another barrier that I find that is related to this this lack of exposure during childhood is a lack of comfortability touching our own bodies. So I mostly have a private practice, but I also work in a hospital, a very busy teaching hospital, 2 days a month, just to have kind of that experience of being in the hospital with people. And what I have found is I used to be very judgmental about hospital IBCLCs, because I would hear so many people say, yeah, the lactation consultant at the hospital, they just grabbed my boob and shoved the baby onto me, and I felt very violated. And I used to say, there is never a reason to have to touch somebody when feeding their baby. And in my private practice, I do way less touching. But in the hospital, I have found that people have such little comfortability with touching their own body. And I will always show on my own body. If I'm telling people to hold their breast a certain way, I will
end
do
up
that.
grabbing my own. I do the same thing.
But they just don't have the same comfortability with touching their breasts. And I think this comes from this culture of highly sexualizing women's bodies in particular, and going even deeper, our breasts. And so we have not been taught to touch our breasts very much. And I often tell people, go ahead and feel around on your breast and see where you feel the milky areas. And they don't even know how to feel around on their breasts. And when they do, they haven't touched their breasts enough to notice what feels more dense and what I call milky,
Right.
or what, because they haven't had that experience. So I encourage everyone who is prenatal to start every day kind of feeling around on their breast, massaging, noticing what you feel when you touch, because that's going to help in the postpartum period. We talk about doing things like compressions while the baby is sucking, because that helps bring more milk in. And the best way to do that is to find the milky areas and compress there. And that's going to be different in every single person, because the mammary glands develop differently in every single set of breasts. So, start becoming very familiar with your breasts in the prenatal period. And once you've had your baby, just do a lot of touching, feeling around, because you're going to have an easier time. So that's another barrier, is just a lack of familiarity with our own bodies. And then, birth interventions do impact how a baby feeds.
We are back from our mini meltdown.
Yeah, that's right. Yeah. So I was just about to start talking about interventions that can interfere with breastfeeding. And the point I was making was, I'm all about informed choice. So the problem lies in that many healthcare providers do not study lactation enough to understand the impact of the interventions done during pregnancy and childbirth on the postpartum period and baby feeding in particular. There's a great book by Dr. Jack Newman called What Doctors Don't Know About Breastfeeding. Dr. Jack Newman is he's an MD. He is an IBCLC. He leads the I can't remember the name of his center, but he has a very famous breastfeeding center out of Canada. He does tons of education for both doctors and IBCLCs about breastfeeding. He has lots of books out. And this newest book that he just wrote is essentially outlining why our doctors are not the people we should be going to for breastfeeding questions. And I always like to work very closely with primary care providers, pediatricians, OBGYNs, because we need them. They are a very important part of the care team. And I always like to say that your OBGYN, they have a very narrow window of practice. It is during that time when you are pregnant through the 6 weeks after your birth. Your child's pediatrician has a very wide window of practice. They are your go-to person for any concerns with your child from the moment they are born until they go off to college.
Right.
Which means they don't have the space to deal with baby feeding. And so they don't always, your OBGYN doesn't always recognize that when they choose to induce you because you're at 40 weeks and 2 days, and there's really no other reason besides the fact that you have gone, quote unquote, past your due date, and then you end up on IV fluids for 3 days during that induction, that can contribute to difficulties breastfeeding, because anyone who has had an IV drip for 3 days knows that your whole body swells. You get engorgement in your mammary tissues. It makes it harder for the milk to come in. It makes it harder for the baby to latch. They are also swollen. And so that initial weight that you get is often not an accurate weight. And then sometimes you get pressured to start supplementing because you've gotten past that 10% mark, which is not really accurate because they've been swollen from IV fluids. Any drug that makes you feel super relaxed and sleepy is crossing the placental barrier. So the baby is feeling that way as well. And I'm not saying you should not do it, but I am saying we must recognize the impacts this has on our baby when they are now in the world trying to nurse. Our babies are often much sleepier, and it just means we need to give them a little bit more time,
Right.
to be able to engage in the feeding behaviors that we expect. So those are a couple of examples of interventions that lead to worse outcomes. We also know that if somebody has a surgical birth, if they deliver their baby via cesarean, often I'll see them 24 hours, 48 hours postpartum, and they have not pumped one time. They have not brought baby to the breast very frequently. If baby's in the NICU, sometimes we see that nobody is helping that parent to understand that the more frequently you are expressing milk in that postpartum period, the better off your milk supply will be. And many people, healthcare providers, nurses, they have this idea that the mom has gone through this major surgery and she just needs to rest and milk supply will come later. But we know from research that there is a very high correlation between immediate and frequent removal of milk, preferably through hand expression, because the pumps, especially the phalange sizes provided in the hospital, are not going to be accurate.
Yeah. They're not what you want.
Right. For removing milk. So learning hand expression, being effective at hand expression, and being able to do that frequently in those early days is going to lead to better long-term milk output. And I recognize that when you are in that situation, patients who are on magnesium, for instance, they are so loopy and tired and dragging that they just have to do the best they can do given their situation.
Right.
But if they do not know, if they have not been informed of the importance of frequent milk removal or frequent breast stimulation, it is not informed consent.
Right. Right. I think that there's so many things that people just don't know, right? I think it goes back to hopefully you're learning these things during a prenatal course, but some people don't take prenatal courses. I think that the world just it makes you think and makes you expect that you're just going to know what to do, and that the hospital, I think it's better now because I think people are more aware that hospital providers aren't always doing maybe what's the best or always giving you all your options. But I think, previous to this time frame in social media, I think it was the expectation that hospital personnel around you were giving you all your options or making the best calls for you, and informing you of the things that could be impacted by making the choices that you make. But I think that, like you said, it's tricky when we're talking about providers who are supposed to know a lot of things about a lot of things, right? I always tell my postpartum clients, when you go to the pediatrician, depending on weight gain, they may try to say this or say that. If you're feeling worried before you do anything, talk to me or talk to an IBCLC or let someone help you understand why they might be saying that. Because pediatricians are great, doctors are great, but they have to know a lot of things. And so, they might not know enough about a specific topic that they might be giving you input on. And so it's really great to be able to talk to someone in the birthy world or someone in the milky world and to be able to kind of help you figure that out, I think is so important.
Yes. And, both nurses who are on the postpartum floor, they have a total of maybe one class period devoted to baby feeding in their nursing school. And that includes bottle feeding, formula feeding, breastfeeding. And so unless they have sought out additional expertise, which some of them do, some of them become CLCs, some even become IBCLCs. But, they are not going to be the people who you need to be going to for difficulties. Same with your pediatrician. And the difficulty with both of these professions is they often don't know what they don't know. And so sometimes they're doing more harm than good when they are advising on baby feeding. The same with sleep. Pediatricians are not baby sleep experts. And
Right.
so if you are struggling with sleep, they are probably not going to be the person that you go to for advice, because the advice that they give, and there are studies that show this, is often more correlated to their own experiences of baby feeding and sleep than it is to any education or research or evidence-based information.
Absolutely. Absolutely. I think that goes, like you said earlier, back to the same thing of like if you're talking to a friend or a friend's talking to you and giving you input, like they're likely giving you what worked for them. And we know from seeing babies and from studies that, every single baby in every single situation is so different. So just because your baby's fussy on the breast doesn't mean that it's the same reason why your neighbors or your friends or your sisters was that way.
Right. Yeah, I can give a great example of this. I just had a client this weekend who had reached out to me because she thought she had low milk supply. Her baby was fussy at the breast. They had been doing a lot of bottle feeding in the last couple of months. And when she thought she had a low pump output when she was pumping, and she was getting, maybe 5 ounces in the first sitting and 2 to 3 ounces in the next sitting. So that's an average amount of milk, but she was also using 24 millimeter phalanges. And so I get to her house, I observe baby feeding, I do an oral assessment, I get her set up in the right phalanges. She immediately pumps like 8 ounces in 15 or 20 minutes in the correct phalanges. And her baby's fussiness was more related to a borderline oversupply than an undersupply.
Yeah.
And there are reasons for this. But if you just go onto the Facebook group and say, hey, my baby's fussy and I'm only pumping 2 to 3 ounces at the pump, they don't have the expertise to dig into what is the actual root cause of this fussiness.
And I find so many times people are expecting to pump this like ridiculous amount of milk because the world has said that you have to have a deep freezer full of milk, which is just so unreasonable, right? I mean, that's like truly, that's an oversupply, right? I mean, I've heard this said before, and I mean, you can agree or disagree, but that the idea behind pumping is great because you can feed your baby otherwise, right? However, whatever you're pumping in a way is extra milk because you should be only making, what your baby needs in a way. Is that kind of the same way that you see that, you see it a little bit?
It's highly variable. So, there are people, if you are returning to work at 6 weeks, you do need a little extra milk to begin providing that because your milk supply is not even fully established at 6 weeks.
Right.
And so that you are going to start pumping earlier than somebody who is returning at 14 weeks or 16 weeks or 12 weeks. So, that's why these questions are highly personal, dependent on your situation, or if you're doing any at breast supplementation due to the growth curve or due to a painful latch, that's going to be different than if you're just pumping because, and in addition to what you're feeding at the body, because you're trying to store milk for the future. And when I say just pumping, I don't mean to diminish what you are trying to do in that situation, because we all have this fear of our babies not getting enough, whether we're going back to work or not.
Yeah, no, that's great. That's totally true. And I love the way that you phrased it. And I think it's definitely, I find a lot of people are so afraid they have undersupplies because of it, because they see that they're supposed to have this much. And it also goes back, I think, to this lack of education. Like people don't know how much, if they are pumping and offering a bottle, they don't know how much their baby's supposed to be getting, which I think a lot of, is lack of education. And the other part of it is also a bit of, if you are just breastfeeding from the breast, you don't know what they're getting, right? But it is, I find a lot of the time people are like, oh my gosh, I only pumped 3 ounces or I only pumped like 4 ounces or whatever. That's not enough. And I'm like, oh no, that could totally be enough. And more times than not it is, or almost too much, right? Then your baby needs that one feeding. And I think that that's such a big education part of it. As a postpartum doula, that I'm constantly talking to clients about, like, no, it's okay. Like, that could likely be enough. It probably is. Like, let's give it a shot, before you freak out about it. I think that that's something that people don't realize.
Yeah, I think the other this goes back to another barrier that I see is we as healthcare providers, we are often saying, well, how many times did your baby feed in a day? And how many pees have they had? And how many poops did they have? And are they feeding for 5 minutes or are they feeding for 30 minutes? And so then what that does is it causes many people to use apps where they are doing this very diligent tracking of their babies. And they could tell you what the graph looks like. They could tell you exactly how many pees and poops and the color of the pees and poops and how big they were. And, they have all of this data about their babies. But when you ask them, what is your baby's earliest hunger signal? Have you figured that out yet? They can't tell you. And so what I try to do is both recognize that because people are often getting asked these questions, and of course, as an IBCLC, it's helpful for me to know, is your baby only eating 6 times a day or are they eating
Right.
20 times a day? Like that, having an idea of how many feedings there are is important, and helping parents to move away from getting all of the information and recording it and tuning in to the baby that you have in your arms there in front of you, because we are going to get the best information about how feeding is going and about what we quote unquote should do from getting to know our babies really, really well. So I will often prescribe to families who are feeling very anxious about baby feeding to stop tracking for like X number of days and see
Right.
how you feel once you stop tracking and start tuning into your baby.
Absolutely. And I'm so in back and forth on that like tracking as well. And I typically will kind of talk to families about it and be like, take this in the way that you think is going to best support you. But for some people, having a little information is great. But like, I very much am on the same page of like, we don't need to be tracking everything to the exact minute all the time. You are in this constant 2 to 3 hour loop all the time, every day for a while there. So sometimes it is helpful to write down when they last ate or when they went to sleep, because it's going to all blur together. But at the same time, counting, by the millimeter how much they're taking, and, all of that information can end up being almost like too many numbers. It can be discombobulating. It can be overwhelming for sure.
Yeah. And then, this is highly individual too. So for some people, I have had clients who have moved to exclusive pumping and bottle feeding because their anxiety is so intense that they need to be able to see the amounts that their baby is taking. And that is the right move for some people. And other people need to be given permission to say, look at your baby. He is clearly relaxed after this feeding. Look at his rolls, look at his growth chart. He's never fallen off of it. Look at how he acts before a feeding and after a feeding. You clearly are feeding this baby well. And it might do you good to just tune into him and not worry about how many feedings a day there are, because that is making you more anxious if he has
Right.
fed only 8 times instead of his usual 10, or if he's fed 15 instead of his usual 11. Like,
Right.
then we start to be trying to interpret every little change in the data, when, as anyone who has raised a child for longer than 4 months knows, as soon as you think you have a pattern, it changes.
Yeah.
And that doesn't stop. It doesn't stop all the way. My oldest is 10. It hasn't stopped yet. So you just have to get used to recognizing that, yes, we know our children, and our children are constantly changing.
Absolutely. It's ever changing. I love that. I think there's so many barriers that go along with things. And I think the biggest thing that you've mentioned that I think people should truly take away is that everything is so personal, right? I mean, your barriers could be similar to the ones that you've talked about today. They could be something different. Your barriers are going to be different than someone else's, and your baby and your feeding experience and your birth experience, everything is so different. And so it's really that idea of like, we know we shouldn't be comparing our babies or our situations to another's, but this really is just proof, even more so, that it is so different. So it's truly, truly not worth it to try and, compare those things.
Yeah. Yeah. And if anyone is really interested in this topic of systemic barriers, I highly recommend a book called The Big Letdown. It's by Kimberly Seals Aller. She is a journalist. She is she's very big in the world of lactation and birth. And she wrote this book called The Big Letdown. And the subtitle, I'm just looking for it right now, is the subtitle is so good. It's How Medicine, Big Business, and Feminism Undermine Breastfeeding. And
I love that.
Some people are shocked to hear feminism grouped into that. I encourage you to read the book because she is not anti-feminist, but the idea is that the idea that we can have babies and do it all and go back to work and bounce back and just be the same as we were before we gave birth as after is unrealistic. And so
100%.
How do we both create societal supports and supports within our own families to recognize that it is not going to be exactly the same? And going back into the workforce at 12 weeks, right when your milk supply changes from what we call endocrine hormonal control to autocrine hormonal control, means that you do often start to see a dip in your milk supply right about the time that you're needing to go back into work, because we don't have family leave policies which are appropriate for people trying to feed human milk to human babies.
Yeah, I think there's so many things to it. So many. I think it's absolutely, we could talk about this for like hours and hours, and you'll definitely have to come back on and we'll chat some more. But in the meantime, everybody can head over to the podcast, and I will put your information below as well, and some of the stuff that we talked about today, so people can, keep track and check it all out. But thank you so much for joining me. I appreciate it. And I'm excited to hopefully have you back again.
Yes, this is awesome. And I can't wait for you to come on and share some of your expertise on the milk making minutes.
Thank you.
Great. Thanks.
Thank you so much for tuning into the Postpartum Plan podcast. I hope that today's episode brought you support, relatability, and valuable insight. Remember, you're not alone on this journey. If you enjoyed the show, please subscribe and leave a review and share with any of your prenatal and postpartum friends and family. Your feedback helps us reach more parents seeking support. And if you're looking for additional resources, please feel free to connect via Instagram at Serene Moments Doula for constant information, tips, and tricks, or check out my website, www.serenemomentsdoula.com. See you next week.